Hey everyone, and welcome to this explainer. If you're an anesthesia tech student gearing up for your very first day in the OR, you are absolutely in the right place. I know, it sounds pretty intimidating, right? But honestly, don't sweat it. We're going to walk through this whole process step by step so you can walk through those hospital doors with total confidence.
Plus, you are in the best possible hands today because everything we're covering is built directly on the expertise of Dr. Suha Adel Al-Ani. Her background is literally incredible. We're talking a bachelor's in anesthesia techniques, a master's in medical physics, and a PhD in natural sciences from the Free University of Berlin. Add to that specialized certificates in nuclear medicine, radiology, and radiotherapy from Heidelberg University, and well, we are pulling from a massively comprehensive well of knowledge to set you up for success.
Okay, let's just dive straight into the roadmap. Today, we're looking at ethics and prep, first day steps, patient assessment, equipment and airway, drugs and emergencies, and lastly, the golden rules.
Section 1. Ethics and Training Prep.
So here's the deal. The OR is a zero-compromise zone. Punctuality and patient privacy, those are absolute givens. You've got to master strict hand washing and the safe handling of sharps. But listen closely to this one. Mobile phones and laptops are strictly banned in the OR. Seriously, leave them in your locker. And remember, never execute an action or mess with a device unless someone is directly supervising you. You're there to learn, and to learn safely.
Section 2. First Day OR Steps.
Let's visualize your physical timeline here. Once you walk in and scrub in, you'll be introduced to the surgeons, the nurses, and the techs. Now, the OR is a highly sensitive environment, so your very first mission is super simple. Just find a corner out of the way, stand quietly, and observe. Watch how they prep the anesthesia machine and do the leak tests. Pay attention to how the patient is brought in and how vitals are started. In these early days, your job is really just assisting with straightforward tasks, like handing over items or securing lines.
What's actually really fascinating is the huge contrast between the two main phases of your shift. During the surgery itself, you are on high alert, you're continuously keeping an eye on blood pressure and oxygen saturation and executing the doctor's orders rapidly and exactly as they state them. Again, absolutely no independent actions. But then post-surgery, the adrenaline kind of drops. The focus shifts to this methodical cleanup, disconnecting monitors, cleaning tools, and getting the room completely prepped for the next case.
Section 3. Patient Assessment and Vitals.
Let's ramp up your technical toolkit, starting with basically the universal language for assessing a patient's pre-op health, the ASA classification. It's pretty straightforward. Class I is a normal, healthy patient. Class 2 means mild systemic disease, while Class 3 is severe. Class 4 is a constant threat to life. Class 5 is a morbid patient not expected to survive without the surgery. And Class 6 is a brain-dead patient whose organs are being removed for donation. Getting a grip on this classification instantly tells you the risk level of the case you're walking into.
Next up is the monitor, which is literally your window into the patient's living status. You'll be constantly tracking blood pressure, pulse rate, respiratory rate, temperature, and oxygen saturation, or SpO2. So, here is your mandatory homework before your first shift. You need to memorize the normal versus abnormal values for every single one of these vitals. By heart, no exceptions.
Section 4. Equipment and Airway Management.
Right, so this brings us to the most critical piece of equipment in the entire room, the anesthesia machine. You need to know its parts inside and out. Doing the machine check and the leak test before surgery, identifying your medical gas and oxygen sources, understanding the breathing circuit. I know it might seem like just a routine checklist, but these steps are literally the absolute first line of defense for keeping your patient safe.
When it comes to securing the airway, there are a few fundamental tools you've got to know: the face mask, the oropharyngeal airway, and the nasopharyngeal airway. And look, even if you aren't the one actually performing an endotracheal intubation at this stage, you really must thoroughly understand the principles behind it. Why? So you can prep and pass the exact right instruments to the anesthesiologist without a single second of delay.
Section 5. Essential Drugs and Emergencies.
Let's quickly run through the common pharmacological tools you're going to see all the time. We're talking propofol, ketamine, midazolam, fentanyl, lidocaine, and of course crucial muscle relaxants like succinylcholine and rocuronium. Dr. Suha's advice on this is crystal clear. Before you even set foot in the OR, you have got to review the basic uses and side effects for every single one of these essential medications. Because look, when an emergency hits, seconds literally dictate outcomes.
Your basic life support protocols have to be second nature. You need to know the exact location and contents of the crash cart long before you ever actually need to open it. Same goes for understanding IV line setups and calculating basic fluid rates. It's exactly this kind of preparation that transforms panic into life-saving precision.
Section 6. The Golden Rules.
Okay, let's slow things down for a second and focus on your mindset. Sterilization is more important than speed. Keep this front and center in your brain. Rushing catastrophically compromises patient safety. Proper hand washing, wearing your sterile gear, safely handling sharps, that always comes first. Speed? That'll come with experience. For now, prioritize sterilization and remember that you're there to observe far more than you speak.
Which leads perfectly into this next golden rule. Mistakes are acceptable in learning, but negligence is not. Look, learning is a gradual process. No one expects you to know every little thing on day one. But negligence, that's what causes danger. If you have questions, and honestly, you absolutely should, hold on to them. Ask them only after the pressure drops and the room is calm. Never, ever interrupt the team during a critical moment.
So, after all this vital prep, mastering the machine, and really understanding your precise role, are you ready to step into the operating room? I really hope this explainer has given you the confidence and the clear structure you need to jump into this life-saving rotation. Remember, every great expert was once a beginner, standing quietly in the corner, learning with passion. Good luck on your first day.